Hi class, this is Dr. Shahada, and in this video I'll be going over Chapter 13 titled Public Health Preparedness and Policy. So when we're talking about disasters cause death, injury, disease, and property damage on a scale beyond the routine emergencies to which health systems are accustomed to. However, many natural disasters are predictable. So when we're talking about hurricanes, blizzards, and forest fires, and vulnerable areas generally have plans to deal with them. Although the adequacy of these plans may not be obvious until they're put to the test, these plans usually include prior evacuation of the population in affected areas to minimize negative health effects and loss of life. Other natural disasters may be unpredictable, like earthquakes, but even these unpredictable disasters tend to occur in specific geographic areas. An example would be, in California, here in Florida, when we're talking about hurricanes and when hurricane season happens. So a lot of times, knowing that these areas have this risk of these type of natural disasters allows communities to be prepared through having strict building codes, requirements that appliances be secured, easy turn off of gas and electricity, and any other preparations that need to be made. Now, when we're talking about man-made or technological disasters, they're generally unpredictable. Although the potential can sometimes be identified and the possibility minimized through governmental regulation and community planning, typical technological disasters include industrial explosions, hazardous material releases, building or bridge collapses, transportation crashes that may cause chemical or radioactive release, and even terrorist attacks, as was experienced here in the U.S. on September 11, 2001. Now, with most disasters, natural or man-made, they cause immediate injury to many residents of the affected area. So sometimes specially trained and equipped rescue personnel are needed to locate and help rescue people buried in the rubble of collapsed buildings, or to move people out of harm's way in fires or floods. And a lot of times, the people that are right on the front line are the police and the firefighters. And the injured require emergency medical care and transportation to hospitals. So if hazardous materials are involved, measures must be taken to protect these rescuers and medical personnel. The situation can get even more complex when volunteers join the rescue efforts. And usually, when there's many deaths, procedures must be established to identify victims and to communicate with their families. In situations such as these, there's a critical need for coordination of activities, and this leads us to public health preparedness, and in this specific chapter, looking at how policy is brought in as well. So, a little overview of the chapter. We're going to be describing what public health preparedness is and the role of public health community in preparing for and responding to emergencies. We're also going to be going through the idea, just a little bit about the public health emergencies and the types of communities public health must work with to prepare for and respond to specific events. Also looking at some threats from and history of use of weapons of mass destruction. This chapter will be defining what public health threats from biological agents and naturally occurring diseases are, and discuss both the federal, state, and local policies and laws that support public health preparedness and the infrastructure that has been built to support preparedness activities at the federal, state, and local levels. So when we're talking about public health emergency preparedness, it's the capability of the public health and healthcare systems, communities, and individuals to prevent, protect against, quickly respond to, and recover from health emergencies, particularly those whose scale, timing, or unpredictability threatens to overwhelm routine capabilities. So the preparedness involves a coordinated and continuous process of planning and implementation that relies on measuring performance and taking corrective action. So the term public health preparedness and the field that's devoted to thinking about preparing for and mobilizing resources to respond to public health emergencies is relatively new. And this specific definition was actually proposed in 2007 by the Rand Corporation. Now, in the next slide, we're going to be looking at the 4 basic categories when we're talking about public health emergencies. So the first one here, we have the intentional or accidental release of a chemical, biological, radiological, or nuclear agent. Now, this is the release of chemical, biological, radiological, or nuclear agents into a population center that can have have devastating consequences to the public's health. These agents may be released intentionally through an act of warfare or terrorism designed to cause large-scale morbidity and mortality, or unintentionally through human or mechanical error. So an example of this is an explosion at a nuclear plant that may not be intentional, yet it obviously can still expose nearby populations to radiation. Another example is children finding an improperly disposed piece of medical equipment in a neighborhood, playing with it, and ultimately this piece of medical equipment may result in multiple deaths due to this exposure, being exposed to radiation. So that's like another example. Now, when we're talking about the second category, which we're looking at natural epidemics or pandemics, which may involve a novel emerging infectious disease or a re-emerging agent or a previously controlled disease. The third category here is natural disasters. So when we're talking about natural disasters, we're talking about hurricanes, earthquakes, floods, or fires. Now, natural disasters have the potential to impact very large populations, and they really can lead to morbidity and mortality, disrupt basic services, pose environmental challenges, and really completely unhinge a community. Now, public health professionals have long been engaged in disaster response. So as long as there's been emergencies, there's been medical personnel attending to the needs of the population. The CDC actually started responding officially to disasters in the 1960s when an epidemic intelligence service team traveled to Nigeria to help maintain public health programs in the midst of the Civil War. So over the decades, the CDC has developed public health and epidemiological tools to address the realities of disaster situations and displaced populations. Now, the last category here, the fourth one, is man-made environmental disasters. And when we're talking about man-made environmental disasters, we're really talking about events where human intervention, accident, or other engagement leads to this environmental disaster with direct implications on the population's health. An example of this is an oil spill, and I don't know if you guys remember the oil spill disaster in the Gulf Coast that resulted from an explosion on an oil rig back in April 2010. There's actually a movie on it, and it is just, very sad, and it's really the perfect example of what a man-made environmental disaster is. Now, here are the primary 4 basic categories, but then there's a 5th one that is brought to our attention, and what this is, as defined by the World Health Organization's international health regulations, is an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. So this is when An emergency can involve any of the 4 types of public health events as long as it has this potential to cross the borders. And I do want to mention that, government officials have obviously been aware for a long time on this need to have coordinated action to detect, report, and respond to public health emergencies, but U.S. preparedness infrastructure didn't really take shape till the attacks on September 11, 2001. And this specific terrorist attack was, impacted our nation in such a devastating way. And it was when 2 jet planes hit the World Trade Center towers on September 11, 2001 at 8:46 a.m. and 9:02 a.m. And I'm sure most of you remember where you were when it occurred. I know I do. And I remember watching it on the news that morning, and I couldn't really comprehend and truly fathom what was going on. That morning, you had New York City police, firefighters, emergency medical workers. They were all rushed to the site. Firefighters and police launched rescue and evacuation efforts, and emergency medical workers set up temporary medical posts to help treat injured survivors. Between 13,000 and 15,000 people were successfully evacuated from the towers before the South Tower collapsed at around 9:59 a.m. Not too long after, about 10:28 a.m., the North Tower collapsed. Tragically, 2,801 people died, including 149 passengers on the planes. The fact that so many people survived the disaster showed that in many ways the emergency response efforts were successful. However, there were also many things that went wrong on September 11. And one of the main issues that occurred is there were a lot of issues with communication, and rescue teams that were in the towers weren't aware of the first tower falling. There was a number of issues that occurred and ultimately became lessons for bettering our public health preparedness efforts. All right, I thought I jumped to this next slide, which is right here. So again, as I mentioned, U.S. preparedness infrastructure really didn't take place until the September 11, 2001 attacks. 2 initial significant organizational changes. First was the establishment of the Federal Office of Homeland Security and the Homeland Security Council within the White House, and then the creation of the Department of Homeland Security. Now, with the creation of the Department of Homeland Security, there was a lot of reorganizing of multiple existing agencies under a single department and creating new responsibilities around Homeland Security and preparedness. So, again, many existing governmental departments and agencies, they established new offices, expanded existing ones, and redirected resources toward preparedness and Homeland Security. The following agencies and offices are most directly linked to the public health preparedness policy at the federal level, and these are Office of Assistant Secretary for Preparedness and Response, Centers for Disease Control and Prevention. The list goes on the next slide. Here we have the National Institute of Health, NIH, FDA, Department of Agriculture, Department of Justice, Federal Bureau of Investigation, and the Department of Defense. Now, these agencies and officers are charged with enforcing many statutes, regulations, and policy guidance documents that form the foundation of public health preparedness. So public health preparedness requires coordination among multiple levels of the government. It recognizes that most public health activities occur at the local and state level. And it's codified by the 10th Amendment of the Constitution, which is the powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states respectfully or to the people. All right, so that pretty much wraps it up for Chapter 13. I hope you found this video helpful. And if you have any questions, don't hesitate to let me know. Take care. Bye.